Jared, are you giving me the countdown or do I start now? If you don't want to talk to me, then text me so you can just say go or something. All right?
Yeah, go ahead. You're live.
All right. I I needed to see a doctor, but I didn't know you're supposed to see a doctor every year or get an annual checkup. Diabetes, high blood pressure, all of this stuff runs in my family. But who could have cared about that? I eat what I want, I drink what I want, and I do what I want. So I don't know what kind of mixture that is or what type of medicine that is, but I just know I just do and live the way I want to live. And that's just it. So I'm not listening to no doctor, no quack. I heard they're quacks anyway. They don't never know what they're talking about. And my family, we live long and we do what we want to, no matter what illnesses or sicknesses we got. All right? So they told me that was ignorant. And they shouldn't be talking about that because I'm a smart woman. But I know one thing. This is the Lisa Baxter Show, giving you the 411 in the kidney world. Hello, hello, how everybody? How you doing? And I hope you're having a great night. Oh man, tonight is going to be a wonderful and a great show. I am so excited. But before I tell you about my guest, I just wanted you to know sometimes we get a little bit stressed and we don't know how to relax and what to do. So sometimes you have to know little exercises on what to do, shake your hands out, and get the little tensions out of your fingers and your hands and out of your wrists going back and forth and what have you. And you'd be surprised how relaxed. And then you might do a little something with your neck, a little this way, a little that way, a little front with, a little back with, a little front with, a little backward, or around this way, you might hear a crunch, and around that way, you might feel something or something might hurt. But after a while, you'll be getting loosened up. So, sometimes you just got to move the body a little bit. Work with your body. Don't work against it because it'll work against you if you work against it. I always say take care of your kidneys and they will take care of you. So I hope you had a wonderful week last week and this week will be even better. I am going to introduce my guest about right now. This doctor is a phenomenal doctor. He loves his patients. He goes beyond the call of duty. I've known him a lot of years. My family have known him. He have treated us. He is just an excellent nephrologist. He's a man that stands tall in his field, none other than Dr. Stafford John. Welcome, Dr. John, to the show, the Lisa Baxter Show. Hey!
Thank you, Lisa.
Oh, you're welcome. You're welcome. I am so glad to have you. I don't even know where to start. You know how I feel about you. You're an excellent doctor. You've been my nephrologist. You're my primary doctor. You get things on point. You know what you're doing, so you excellent in all that in my eyes. You know that. And so many others, because, I referred people to you. You already had your own list of people. You just excellent. And I'm just really glad to say again, welcome to the show.
Thank you very much. It is my pleasure to be of service to you and everyone else.
Wow. Woo, I feel honored. Stop. Well, I'm going to get the ball rolling a little bit, and we're going to take our time, and we're going to really just have our chit-chat talk and let the people know out there how wonderful you are and what you do and how you can help others. Now, what made you get into this type of medicine?
Actually, I was influenced by another nephrologist. His name was Dr. Morel. I think he works at Teaneck Hospital at the moment. Many years ago, when I was a medical resident, third-year medical resident at Coney Island Hospital, I had the opportunity to work with Dr. Morel, and he was able to influence me and point me in that direction. The way he taught, the way he explained things, his humility, his compassion, all of that encouraged me to go into the field of nephrology. And it is a decision that I have no regrets about.
Wow. So he was like a mentor to you.
Absolutely.
because we need mentors and people in our life that help us along and push us ahead, and encourage us and talk to us. So would you say nephrology is a specialty, right? Because I think you had to do the regular field of being a doctor first before you went into a specialist, or it's vice versa. Tell us about that.
Well, nephrology is a specialty or subspecialty of internal medicine.
Wow.
The medical field is divided into several major groups: pediatrics, obstetrics, gynecology, internal medicine, general surgery, etc. Within the field of internal medicine, you have several subspecialties, each dealing with a major organ system. Um, Nephrologists are the specialists in kidney disease, the same way cardiologists are specialists in cardiac disease. Now, after one is trained as an internal medicine physician, he or she can opt to do a subspecialty training, either in cardiology, nephrology, rheumatology, one of the many subspecialties.
Wow.
And that usually requires another 2 to 4 years, depending on the specialty training.
Uh-huh. Wow. Well, you really told us. Wow. Wow. So was it difficult or hard for you, or while you was studying this type of thing and you was making up your mind, or you moved forward to doing it, was any of the training or the studying hard for you in the college, you'd say?
Well, yes, it was, but I never considered it difficult.
Mm.
Every day was a challenge because I enjoyed doing what I did. I did my fellowship in nephrology at SUNY downstate, and it was, in my opinion, the best choice for a fellowship program. It gave me the opportunity to serve patients of all backgrounds from all over the world. We saw diseases that most other nephrology training programs would not see because of the population in Brooklyn. Um, Even though it was difficult, we never saw it in that perspective.
Mm.
Every day was a challenge. It was an opportunity to see something new, to learn something, to help someone. So we do not see that as being difficult. It is simply what we do. So every day you got up and went, whether it is a downstate, the Brooklyn VA, or especially Kings County Hospital, you went with a sense of purpose.
Mm.
You never know what you will see. You never know who you will see. You never know what difficult situations will confront you. But we never saw it as work. We saw it as an opportunity to learn, an opportunity to help, an opportunity to share whatever we can with our patients. And every day was rewarding.
Wow, that's good to know. That's good to know because you're still in the field. And I've been dealing with this a lot of years for the 12 years that I was on the dialysis and 3 years with my transplant. Now, you deal with dialysis patients. What is it like when you deal with a dialysis patient? I mean, what are some of the things you do? You walked into the dialysis center, and what is it you do? I know you probably do rounds, or, give us a little taste of that.
Okay, well, rounding at a dialysis center basically involves assessment of the patients and reviewing their treatments and making modifications as needed. Dialysis patients will have a lot of unique problems. They may have problems with uh, their fluid status. They may have problems with their diet, which would reflect in laboratory abnormalities. They may have problems within the dialysis itself, problems tolerating the treatments. They may develop
Mhm.
hypotension, cramps, or they may have a propensity to develop those. So, your main focus is to address all of those issues, especially the ones that happen within dialysis, because this is the one that is most immediate to the patients.
Uh, wow. All right, so you get there and you go there because I've seen you there. You came by my chair, you sat by my chair, or really stood by my chair. and you talked to me. You always encouraged me no matter what I was dealing with or going through. So I always appreciate that, and you always directed me in the right place, the right way that I should go. Now, when it comes to transplant, how do you deal with people that is either on the list or wanted to be on the list? What are some of the things you may tell them or do or refer them?
Well, I always advise patients that the transplant is still the best therapeutic option for end stage kidney disease. Everyone should be considered for kidney transplant. However, not every patient is a candidate, but everyone should explore the options because it is the best option. So we advise everyone who has stage 5 kidney disease to consider a transplant because the benefits will be multiple. One, there is freedom from dialysis.
Mm,
Two, outcomes are actually better, clinical outcomes, patient survival.
mm,
And three, I will hate to interject it, but the cost of treating kidney disease is lower with a transplant than with dialysis. And as we know, the cost of healthcare, the economics of healthcare is entering our debate. It's entering our politics. There is a lot of discussion on the cost and financing of healthcare. So the fiscal aspect of it needs to be looked into. So transplant is actually better on all of those aspects, medically, socially, patient well-being, patient outcomes, and there is going to be a fiscal benefit to the payers of our healthcare costs, either Medicare or the private insurance in the long run. And in my opinion, it is the number one option.
mm. Wow. Okay. That's good. That's good. I mean, I've heard a lot of options, and sometimes you don't really know how to make up your mind. But if you have a good team to talk to you, or put it together for you, not just on a pamphlet or a piece of paper, but actually explain it to you, you could take it a little better. So I'm glad that you were able to do that. Have you ever had a client or somebody, well, not a client, but a patient that didn't go to dialysis when they were supposed to, skipping the treatments and, wilding out and acting out because it's hard for them to accept or deal with this? Did you ever have anybody like that? And if you did, how did you help them?
Well, of course, human nature being what it is, we did have, or we continue to have patients like that. And the patients may have that attitude based on several factors, most of which will
Sure.
be personal to them. What we try to do in this situation is to educate them. Um, of course, the first part of educating someone is listening. We should
Mm,
not feel that we have to lecture and demand that
right.
the patient do whatever we ask them to do, but we have to find out what it is that is preventing you from being totally compliant. We
Right.
listen, find out what the problem is, and then we move in. My next approach will be to explain to the patient what the consequences of
Mm,
missing treatment or having inadequate treatment will be. In most cases, once you explain everything to the patient in a way in which he or she will understand, they usually will
right, huh?
uh, follow along. And
Mm,
then we then try to work or come up with a solution to that patient's problem.
wow. Well, that's good. You got to care to do that. You know what I mean? Sometimes, physicians and places see so many people. Sometimes they don't know them. Sometimes we feel like assembly line or a number or something like that. But it's good to know that that you would come and explain it and help them through it. So I like that idea. I really do. I like that idea a whole lot. What would you say one of your favorite stories would be, or of being a doctor or having a patient follow through or listen through? What is one of your success stories or favorite stories that you could share with us today?
Well, that is difficult. There have been,
You got many.
quite a lot of stories.
Wow.
I remember in September or October of 1996.
Mm.
Um, we had a patient at one of the local hospitals where I worked. I was new
Mm.
to the hospital, and this patient was also fairly new to dialysis, maybe a year or two,
Yeah.
and he was having a very difficult time with an access. His
Yeah.
access has failed. He's had catheters, and the catheters were malfunctioning, and he was volume overloaded, and he needed to be dialyzed urgently. And I went down, saw this man with a little bit of difficulty breathing. He had a
Mm.
little difficulty laying flat because he was volume overload, and we had to get a catheter in him. And I did. We got that catheter in and we got him dialyzed, and he was discharged from the hospital. He went to Elmhurst, and that was in 1996. And then 2 years ago, or maybe about a year or two ago, someone walks into my office and said, Dr. John, you
Mm.
remember me? And his face looked familiar, but
Yeah.
lo and behold, it was that same gentleman. And
Wow.
it is good to see 20 years or more than 20 years later, somebody that you had worked hard with
Yeah.
walks back into the office, and they are still here
Yeah.
as a result of what you had done for them. That's one of the stories, one of the many
Wow.
stories that
Wow.
comes to mind.
Wow. No, that's beautiful. Oh my God, that is wonderful. It's nothing like that. I can even say that as a social worker when I see a client or when I was a counselor with the youth and I see somebody that grew up and went well, it does your heart good. I mean, it puts tears in your eyes. Your heart does a flutter. Oh man, you're grateful and thankful that you took that job or you took that business and did it. So I am grateful to you, definitely. I'm definitely, and I love that story. I love that story. Now, Dr. John, listen, let me see here. What can I ask you next? What are some of the symptoms of kidney failure? Somebody out there might be looking and they don't know. And I know you know that answer, so you tell them.
Okay. Um, in the majority of cases, kidney disease has no symptoms until it reaches end stage kidney failure and dialysis is required. And that is one of the things that gets um, people confused.
Ah,
Kidney disease tends to be silent,
mm,
as about 50% of kidney disease in the United States is due to diabetes, about 20% is due to hypertension, and about 15% would be due to chronic glomerulonephritis.
mm,
These are silent disorders, and you can start having kidney disease without any symptoms, and this can progress. It progresses over years, and by the time the symptoms arise, it is too late. However, some of the symptoms that may occur early
yes,
are in those disorders, and again, I'm not referring to specific disorders like kidney stones, in which there will be pain,
right,
polycystic kidneys, in which
yes,
there may be blood in the urine and
yes.
pain, etc. I'm
You ain't
referring to
never
the
lied. Yes,
majority
yes.
of kidney
Continue.
disease. It
Mm,
tends to be silent, and one of the first signs for most forms of kidney disease is the presence of protein in the urine. If the protein in the urine is minimal, um, then there would be no symptoms. But in some patients, if the protein in the urine is excessive, what we
yes.
call nephrotic syndrome,
Mm,
meaning you have more than 4 grams of protein in the urine in a day, that may be enough to cause swelling. So, edema or swelling may be one of the signs, early signs of kidney disease, but that only occurs in probably less than 10% of people.
mm,
Now, when the kidneys fail and they're no longer able to remove enough toxins to prevent the patients from becoming symptomatic,
yes.
symptoms will then develop: weakness, tiredness, nausea, shortness of breath,
Mm,
inability to concentrate, poor appetite, weight loss, etc. those are the symptoms of advanced kidney failure. And if you already have those symptoms, then you should be contemplating renal replacement therapy, that
Yes.
is dialysis and a transplant.
Wow, wow, yes. Now I've had some of those symptoms. First, I didn't see any, and then I started having them, like you said, with the swelling and stuff like that. And I have polycystic kidney disease. So later on, I saw blood in the urine. I didn't see it, before. But wow. So I'm glad you're saying this and you're putting it out there because a lot of people don't know or they don't understand. Now, what are some of the things? Now, we know high blood pressure and we know diabetes. Diabetes is definitely the number one cause. But what are some of the symptoms of high blood pressure and some of diabetes, since those are the big causes? There's other causes, of course, for kidney failure, but that's some of the causes. What would you say some of the symptoms of high blood pressure first and some symptoms of diabetes?
Okay. In Let's start with hypertension.
Yes.
Hypertension, hypertension usually is silent in the beginning. As the blood pressure rises, it can have an impact on the blood vessels
Mhm.
and subsequently organ dysfunction, that is kidney damage, etc. But in the
Mhm.
beginning, high blood pressure has no symptoms. But if the pressure gets extremely high so that it can damage the blood vessels in the brain, you may
Wow.
get headaches, it
Yeah.
may cause blurred vision,
Mhm.
it may cause nausea. But by the time you're getting those symptoms, it means that the blood pressure is already beginning to affect the micro vessels or the small blood vessels in an important organ.
Yes.
That is usually called malignant hypertension or accelerated hypertension.
Mhm.
But and that is usually seen when the diastolic blood pressure is usually 120 or greater.
Yeah.
However, if you have blood pressures, diastolic blood pressures between 90 and 110, most patients will be asymptomatic. They will have no symptoms at all.
Mhm.
Now, that does not mean that organ damage is not occurring. It is occurring, but it is occurring at such a slow pace that it does not cause the symptoms. The symptoms, the headache, nausea, blurred vision that you see is actually caused by tiny areas of swelling that is occurring in the brain.
Wow.
That's why the symptoms develop.
Whew.
Now, moving on to diabetes.
Mhm.
Diabetes, again, could be asymptomatic for many years. And diabetes is basically the inability of your body to regulate the blood sugar. When
Yeah.
you eat, you will break down carbohydrates into glucose. Your body would absorb the glucose, and to prevent the glucose levels from rising too high, your body makes insulin. So
Mhm.
you eat, you digest the food, break down the carbohydrates into glucose. The glucose is picked up by the bloodstream and it is carried first into the liver because remember, the liver is the first pass, it is the first place that the blood leaves after leaving the intestines, because that is where the body has the opportunity to remove any toxins that was absorbed. The
Wow.
liver, therefore, the liver is an excellent place to put a sensor for glucose. So there is a sensor in the liver which senses the rise in the sugar. That
Mhm.
sends a message to the pancreas to make the insulin to prevent the sugar from rising too high.
Yes.
Whenever diabetes occurs, there is usually a breakdown in one of those arms. You may A, have an impaired sensor, or B, the signal into the pancreas to produce insulin is delayed, or
Mhm.
C, you do not produce enough insulin, or you do not produce insulin at all. But at the same time, even if you do produce insulin, there may be an abnormal insulin response. So you might be producing the correct amount of insulin, it is just not having an impact at the organs where it should. So when that system breaks down, the glucose levels begin to rise. In the beginning, if the glucose levels are not very high, no symptoms will develop. But that does not mean that damage to the organs from the sugar will not occur. As long as the sugar is elevated, there is a potential for organ damage to occur. In other words, any diabetic with an A1C that is greater than 6.5 is at risk for the development of end organ damage. Of course, the incidence increases with higher A1C levels.
Yes.
However, if your sugar becomes very high, then it spills over into the urine. When that happens, you will urinate a lot because the sugar in the urine will pull water. As a result, you
Wow.
would have an increased volume of urine, you become a little dehydrated, and you become thirsty. So you drink a lot.
Yes.
So
Say that.
they drinking a lot and urinating a lot tends to occur when the sugar levels are very high. But that does not mean that if it's not happening, you do not have diabetes. Also, if your body is not getting adequate glucose, in other
Mm.
words, you may say, well, what do you mean with sugar? With
Yes.
diabetes, the sugar is high. What do you
Yes.
mean you're not getting adequate glucose? In diabetes, the sugar is high in the blood, but it does not get into the cells where it is needed to make energy. So the cells are actually starving in the setting of plenty. They are
Mm.
surrounded by lots of sugar. They just cannot use it because the insulin mechanism is not working. When that happens, the cells begin to break down. And as a result, the patients might actually lose weight.
Mm.
So some of the symptoms of uncontrolled diabetes could be unexplained weight loss, tiredness, passing a lot of urine, getting
Yes.
very thirsty. And as the diabetes progress, you can then have end organ damage. So if the sugar remains high for a long period of time, it can damage the nerves, it can affect your wound healing. And as a result, some people might only find out they have diabetes
Mm.
after an injury when the wound does not heal well.
Wow.
So, to summarize, diabetes tends to be asymptomatic in the beginning, but if it is uncontrolled, you can have what we call polyuria and polydipsia, being very thirsty and drinking a lot of water and making large volumes of urine. You may start losing weight. And if you have nerve damage, you might get neuropathic pains, or if the sugar affects the circulation, then you can have impaired bone healing. So small injuries such as cutting your toenails, etc., may result in a foot infection. And some people only find out about diabetes at this point.
Wow. Wow. Well, I know they can get amputations and all kind of things happen in this case, you know? Now I
Yes, they
know,
can.
hello?
No, I agreed with you.
Oh yeah, yeah. They go through so many things. What now with being an advocate and helping people and stuff like that, doing this show for 7 years and what have you, doing all of these things that we all care about people, what would you say to somebody that, because I ran into people that don't want dialysis at all, and I keep telling them it's important. If it was that easy, I would have ran myself. If it wasn't important, I wouldn't be doing it, or I wouldn't have went, or I wouldn't have got a transplant. I wouldn't have educated myself. Now, somebody that's not even giving dialysis a chance and they need dialysis, I want you to say something to that person.
Okay, well, dialysis is not as bad as people think. One of the most common reasons that people give for not wanting to start dialysis is that they will remember a bad outcome. And most of them will say, well, I remember this man who went to my church who went on dialysis and he died 6 months after. Or I had my Uncle Joe, his wife. She went on dialysis and she was sick all the time, and I don't want that to happen. And the first thing I tell these patients is you are only hearing the bad stories. You're only hearing the people that complain. What about the thousands of others that don't? Because for every person who has a tough time with dialysis, there are many others that live full lives. I tell them, look, some of the people, that you work with in the offices that you frequent every day. Maybe
Yeah.
the lady in the post office, maybe the nurse that took care of you in the clinic, maybe even the doctor in the hospital, the police officer. You cannot tell if they're on dialysis because you will not know. The ones that are doing well on dialysis will not tell you about it. You would not know. And there are people that you will meet or pass in the street who are doing dialysis and have been successful. I have known physicians, I've had the opportunity to work with several physicians who were on dialysis and work full time as physicians. Dr. Yelemzed Watercall and Dr. Peter Lundin were two outstanding examples. Dr.
Wow.
Watercall, for 3 years, 2 years at SUNY, never took a day off from work. She worked every day. The only day she took off from work was when she needed to have her access fixed.
Woo.
And those are the success stories that people never talk about.
Right, right. Boy, I
So I
could use them
encourage
on the
them.
show. That's excellent. Wow.
So the first thing I tell them is you are hearing the bad stories, but the good stories far outnumber the bad stories because the success stories on dialysis are in front of you every day, and you will walk right past them
Yeah.
and not recognize them. The
Hmm.
second thing that I will go on to tell them is I will sit down and explain to them what are the potential bad outcomes with dialysis. And yes, these would include hypotension or drop in the blood pressure,
Yeah.
sometimes cramps. Sometimes the
Hmm.
patients might feel very tired and wiped out at the end of the treatment. They may have problems with infections of the axes, etc. But those happen infrequently, and those are treatable and preventable conditions. So I let the patients know that even though these things do happen from time to time, they are the exception and not the rule. And whenever they do occur, there are interventions that we can do to take care of it. So if you're on dialysis and you're cramping a lot, then you need to talk to your doctor and to the nurse. Let them know I cramp every time, and there are interventions that could be done. If you notice that you're feeling very wiped out and tired at the end, then there are interventions that could be implemented. So the presence of those symptoms does not mean that this is how the treatment will go
Yeah.
for the duration of your life. It's
Mhm.
temporary and it is treatable, and there are fixes.
You said a mouthful. That is so true. Because a lot of them, I have said that too. And I said, well, I'm standing in front of you. Because a lot of times they didn't know I was on dialysis unless they saw the catheter in my chest or unless they saw my fistula, which I still have that work that I don't need, So, that's right. You do have to outweigh, the good with the bad because that's all you ever hear, is the bad. So, yeah. So that's what you have to do. And I'm glad that you did that. One thing I loved about you is in spite of you having working at a hospital, working in a dialysis center, plus your own practice, you took time to come to my job and I invited you to explain nephrology to my clients. I mean, what I liked about you too, you came. You didn't act so busy or so high and mighty or just threw me down because I was your patient or anything. You came and you presented well and they learned a lot. And what really got me is that I think you spoke Spanish to one of them and I'm like, oh my God, I've known you a long time. I didn't know you spoke Spanish. I thought you spoke something else and not Spanish. I ain't mad at you. You better go ahead. Woo, you ain't never lied. So I do, I do take my hat off to you for that. You know what I mean? And my family just crazy about you. They love you. They respect you. I respect you and everything. Is there is there anyone that you would like to give a shout out to or somebody that you wanted to acknowledge before I end the show or anything maybe we didn't talk about that you might want to say or bring or add a picture of something, a diagram, I don't know, a song and a dance. No, I'm just kidding. But good.
Well, There is no one in particular that I would like to shout out to, but to all of my patients, to all of my colleagues, everyone in the dialysis community that show up every day to make sure that the patients are taken care of, to help the patients in every way. I salute you. It is not an
Yeah.
easy job, and I salute you all for doing that. I must say that. Um, to me, it is an honor to be able to help people. I see this as an opportunity to serve. And I do believe that to him, that much is given, much is expected. So,
Yeah.
whatever I was blessed with, I am more than happy to share with the community, to share with the world. I do believe in patient education because I believe that knowledge is power,
Yeah.
that the more educated our patients are, the better the outcomes. The more we understand about what is
Yeah.
going on with our bodies, the more we are likely to take care of it. And the more we understand about our disease and our treatment options, then the better choices that we make. So, any opportunity to share knowledge, in my opinion, is sharing power, is strengthening patients, it's allowing patients to empower themselves and to make better decisions, whether it's treatment decisions or personal decisions. And I think that the time and effort spent doing that is well spent.
Wow. Well, thank you. That's beautiful. I just wanted you to know Manning is definitely watching. Jovan, Alicia. Uh, I mean, you just got a slew of people and fans that are watching you. So I just wanted you to know a lot of us are your patients, and they all are watching, and some new people that's not your patients that maybe just become your patients. But they at least know there are good doctors out there. Everybody is not a quack. Everybody is not crazy or off. I'm glad you on point. I'm glad you studied and did your thing. And I thank you for coming on tonight and just making me very happy and very proud.
Okay, thank you, Lisa, and thanks for giving me this opportunity. And I'll be more than happy to do this another time or any other time. Thank you very
Woo!
much.
You heard it. No, just, I know you're a man of your word. Thank you, and you have a good night. And I'm about to end the show. A million blessings,
Okay,
sir. Thank you, doctor.
all right. Thank you, Lisa. Okay,
You're
good
welcome.
night.
Good
And
night.
good night to all the listeners.
Guys, you have heard it. You have heard a great thing. That is some good teaching, some good nuggets. So if you out there and you missing your treatment, or you not missing your treatment, or you think you got diabetes or high blood pressure, you had got some instructions on the Lisa Baxter show tonight. Yes, you did. So I am glad you tuned in. I love you. I respect you. I honor you. My hat is off to you. And I thank you for honoring this network, this Urban Health Outreach Media Network. Share it with your friends. Tell somebody about it. Learn from it. Use it. Use it to your advantage. We do appreciate you and honor you and thank you. Good night. A million blessings. Next week, another good show. Peace. Victory.
Thank you. Okay.
Good night.